Hi, my name is Dr. Ken Anderson. I'm here at the Anderson Center for Hair, and today we're going to talk about combination FUE and FUT procedure. So what is a combined FUE-FUT procedure? Well, it's a situation where typically we want to maximize the harvest and yield of the follicles to be transplanted in a short period of time. To accomplish this, we perform an operation on 2 consecutive days. On the first day, a full FUE procedure is performed. The grafts are extracted, harvested, trimmed, and then implanted into the areas of need on the first day. On the second day, the very next day, the patient comes back and we do a complete FUT, or linear strip procedure, where a strip of scalp through the permanent zone, so through the safe zone, is harvested, and 100% of the follicles within that strip are used in the transplant. And then on that second day, all of those follicles are transplanted, so that after a 2-day surgical procedure, the 2 days being spent here at the Anderson Center for Hair, of course, the patient goes home or back to the hotel at night, we can extract the maximum amount of follicles in the shortest amount of time. You may be asking yourself, well, am I a good candidate for the combined FUE-FUT procedure? What about me? Well, let's discuss what makes a good candidate for a combined FUE-FUT procedure. First and foremost, patients who need a lot of hair. You know, if you have a slight recession at the frontal hairline, or maybe a small spot in the crown, you're not going to need 4,000 follicles. You know, those are much smaller cases. So the patients with minimal hair loss, minimal to even moderate hair loss, typically don't require this type of procedure. But if you have a large area, a large spot in the crown, a missing frontal hairline, and a lot to reconstruct, then this may be an option to consider. Patients really need to be committed to future hair loss prevention. Okay? Hair loss never stops. It's going to continue throughout your life. It's a progressive phenomenon. It may appear to stop for a number of years, and I've had many patients come in, I haven't lost hair in 8 years. Once it starts, it's going to continue at some point. So prevention is always key. My happiest patients are ones that thoroughly engage in hair loss prevention strategies, and these are things that we discuss in the consultation appointment. But those are some reasons that make a patient a good candidate for a combined FUE-FUT procedure. You might be asking yourself, well, what are the advantages and disadvantages? So let's go over that. The main advantage is a maximum harvest of follicles. You know, if we're looking for 3,000, 4,000, up to 5,000 follicles in a 2-day procedure, this is how we accomplish that. And then you consider how long the hair takes to grow in. Typically it takes a full 12 months for that hair to grow in. I talked to a number of patients and they tell me that one of their biggest regrets is that they didn't do it sooner, because they work up the courage to get it done. They have their transplant, and now it's a year-long waiting period. This is one way to sort of combine all the follicles into a 2-day surgical period, and then a year later you'll have the results of 2 procedures instead of doing one at a time, and the whole process taking 2 years. As I tell patients in consultation, straight up, pain is bad for business. Nobody wants to see reviews about patients in pain. As a result, I personally do all the anesthesia myself to make sure that it's as comfortable as possible. I will say that where the follicles are placed in the recipient area, that area is numb, and patients never complain about having pain, on the frontal hairline or on the top of the head or in the crown where the follicles were placed. It's in the donor area that some minor discomfort can occur. The FUE procedure, all those little wee harvest sites, I'm told it's like a mild sunburn on the back and sides of the head at worst. And with the FUT, it's kind of like a minor bruise, a little bit of a bruise on the scalp. So I guess the combined procedure would sort of be a little bit like a minor sunburn and a minor bruise, but really not a feature of the procedure. Nobody likes to get hurt, and patients are often, frankly, surprised at how painless and pain-free the whole procedure is, including the combined 2-day FUE-FUT procedure. I do have a story to share about about pain control. You know, it's important. I received this phone call. I always talk to my patients the day after the procedure. And I got a call from him, actually. He beat me to it. Called me early in the morning. He says, Dr. Anderson, I've got a problem. And I'm on the phone. I said, yeah, how you doing? We'll call him Dave. I'm like, how you doing, Dave? He's like, you know, I'm fine. You know, I got to tell you, Dr. Anderson, I'm not having any pain. I said, good. That's, you know, I had a couple of patients say that prior after I modified the technique slightly. And so I wasn't surprised. And I said, okay. I said, good. How can I help you? He's like, and he repeated himself. Dave said, Dr. Anderson, I'm not having any pain. I said, well, okay, that's great. Do you have any questions about the instructions? And he said to me, he says, Dr. Anderson, I don't think you seem to understand. I'm not having any pain. And I said, Dave, are you calling me because you're not having enough pain? And he said, yes, Dr. Anderson, I don't feel like I've had a procedure. I think something's wrong. And I just thought, you know, I reassured him. I said, David, everything's fine. You know, it's the way the procedure is done. You know, we don't want a lot of discomfort. So you may be one of the lucky few who has so little pain that it's perceived as no pain at all. I just thought I'd share that. The question that comes up a lot, you might be asking yourself, does it matter where the grafts harvested with FUE are transplanted to versus the FUT grafts? And the short answer is no. You know, follicles from the permanent zone, from the safe zone, are the ones that are used in the transplant. Essentially, a transplant works by transplanting those hairs to areas of need. Nobody bothers to tell those follicles that they've been moved, and they continue to grow as if they're on the back and sides of the head in the permanent zone. Another question that comes up, and you may be asking yourself, is the sites, the recipient sites that are created on the first day of surgery that are intended to receive the follicles harvested with the FUT on the second day of surgery, will those recipient sites stay open? And the short answer is yes, they do. A thin fibrin plug gets in those sites, but that is easily separated apart using the jeweler's forceps that our technicians use to place the follicles. And there's actually an advantage to doing the sites on the first day and then planting the follicles on the second day. The tiny wounds, the recipient sites, get a full 24 hours essentially head start on the wound healing process. And the little tendrils of neovasculature and new blood vessels get a little bit of a head start. And so it is thought to actually enhance the healing process and ostensibly the results.